Thank you, Mr. Chairman. Thank you to each of you for being here. I had a great roundtable last Friday with healthcare innovators in Nashville. And of course, we've got great work that is being done in health IT there, a lot of AI that is being done. HCA, one of our hospital corporations, has really deployed so many AI tools to help with clinical decision support, nurse handoff, documentation, things of that nature. One thing that came up was CMS and the reimbursement framework. And Mr. Shin, I do want to come to you on this, and I know it's been brought up before. There are deficiencies, there are discrepancies. You've got a coding that calls for this, and this, and then over here you've got this new technology. So this came up at the round table. So talk to me a little bit. Let's drill down a bit more on these deficiencies and these gaps, and how can CMS move forward and fix that so that patients have the access to the best possible?
Yeah, really appreciate that question, Senator. I think you've identified the issue spot on here. With CMS, we are seeing inconsistencies and an inconsistent message in terms of how do we appropriately reimburse for these AI technologies. From a practical standpoint, what we're advocating here for is kind of a predictable and consistent approach that is really focused on clinical AI solutions. So these are really algorithm-based healthcare services that are providing both quantitative and qualitative clinical information to the physician so that he or she can make
Should CMS be more prescriptive in how this gets handed back to them for reimbursement?
Yeah, I think what's plausible here is that there's pathways that are already in place. There's infrastructure already placed within CMS.
So it's our job here at Finance Committee to tighten this up.
To really push them, in terms of consistency and really advocating now for reimbursement for, again, these FDA-cleared clinical solutions that are already covered under Medicare. Yeah.
All right, then Dr. Mello, same type thing on regulation. When you look at the regulatory frameworks and the balance that needs to be there to establish those standards, talk to me about how this keeps up with that evolving landscape.
So I think what your question raises, Senator, is how do we get this balance between innovation and patient protection right? And I think the critical step that CMS and other agencies and Congress could take at this stage is to convene experts in the field to begin to set consensus-based standards about how algorithms need to perform and about how the people who use them need to plan for their deployment. So CMS could do this, for example, as part of Medicare conditions of participation. I think it would be a terrific way to get the attention of healthcare organizations that are using AI tools but not planning for them in the way that they should and not monitoring them.
Dr. Baker, I think I'm saying that correctly. I got it. Okay. You talked some in your testimony about AI's potential to overhaul healthcare payment systems. And as we look at value-based payment models, we're there with you on that. It doesn't matter if it's blockchain, if it's AI, but achieving that potential. So how do you envision policymakers really harnessing AI effectively to refine these payment systems?
Well, I think there are two mechanisms that might be low-hanging fruit in that way. One is that we don't really pay for improving, avoiding future health risk. Right now, if an insurer does a great job at reducing the likelihood of future heart attacks, there's really very little payment associated with that. So there's a real barrier to investing in that kind of care. AI can generate markers of future health risk that we don't currently have. And when we have a good marker,
predictive diagnosis.
Then we can pay for it once we
Okay.
have a better marker. So that's one mechanism. Another is in sort of smoothing the way that we deliver care now. We can actually reimburse for quality of care that patients are getting today in a much more nuanced way, drawing on the the data that we can now process with AI. All of these data sets have existed before, but it was very hard to boil them down into
Okay.
something you can
My
use to pay.
time's expired. Thank you.